This is Pooja Shankar. I'm the clinical nutritionist at Alleviate Pain Management. You might be wondering what food and nutrition has to do with pain management. Let me tell you. Well, there's nothing new when I say it for a fact that food and nutrition has a lot of influence in your overall health and well-being. So don't you think it's not surprising that food and nutrition has a vital role when it comes to prevention as well as management of chronic pain? The chronic pain is determined root cause for several autoimmune diseases, type 2 diabetes, cancer, arthritis, cardiovascular diseases, so on and so forth. So we should do everything that we possibly can to avoid these outcomes. Clinical analgesics, treatments, physiotherapies, intervention programs, surgeries, all of these, they come in the first step when we are dealing with chronic pain. But you should not forget that nutrition, food and lifestyle changes have been a standard protocol to mitigate chronic pain. Have you ever heard of this term, you are what you eat? This is basically implying that every food that I intake into my body is changing my body's chemistry. It's not an exaggeration at all when I say this. That too, when people are dealing with chronic pain, every food they are intaking, it's either increasing their pain and inflammation or it's decreasing their pain and inflammation. It's as simple as that. Food can play a good cop as well as a bad cop role. When we consider the relationship of food with pain, I can broadly classify it into 4 different categories. 1. Nutritional insufficiency. 2. Inflammatory and pro-inflammatory foods. 3. Gut and body microflora. And 4. Overall eating habits and my lifestyle. When we are talking about nutrition in chronic pain management, we often use gibberish terms which might sound a bit intimidating, like antioxidants, polyphenols, anti-inflammatory foods, flavonoids, bioactive components and all of these. But I want to make sure that you understand nutrition is not as complicated as it sounds. For an instance, let's take a balanced meal. Okay, this plate is what that denotes a balanced meal. Let's divide it into 2 halves. The first half will be divided into 2 other halves. The first quarter of the plate denotes carbohydrates. The second quarter of the plate denotes your proteins. The bigger half, the third half of the plate is where we talk about the salads. This is what a balanced meal looks like. But when I'm talking about nutrition in chronic pain management, I'm either adding food into this or I'm removing food out of this. It's as simple as that sounds. Along with managing these kind of changes in the meal, nutritional management during chronic pain also helps in improving your immunity. It helps in bringing you to an ideal body weight and it eases the symptoms of these painful flare-ups. For chronic pain management, all of these are very important. A personalized treatment, medication, therapy, counseling as well as nutritional assessment and management. With all of these together, we can provide a formidable and a highly promising outcome and improve the quality of your life. If you're suffering from any chronic pain or any nutritional related queries, you can always reach us at Alleviate Pain and Spine Management.